Hey guys, welcome back for our daily practice questions. As always, you know I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, videos, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you as well as needed. Now, y'all know I always get into my disclaimer and reminder before we get started with our questions for today that we know there's no absolutes in medicine. We treat on a patient by patient basis. So, any of the questions that you see here, I have designed based on the guidelines that are currently being tested on the ANCC as well as AAMP exam. Now, any videos that I do where I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student are discussing SSRIs. All of the following are SSRIs except is it A, sertraline, B, fluoxetine, C, Cymbalta, or D, citalopram? Take a moment and tell me what you got. All right, so I always recommend reading the stem of the question first, so it allows you to slow down and ensure you're answering what is even being asked in the question. So the stem of the question here states all of the following are SSRIs except. So this is a key reason why we like to look at the stem of the question first because this word except is one of those absolute terms like not, best, initial that they may put in the stem of a question. And if you're not paying attention, you can easily miss what you're even supposed to be answering. So here we're actually looking for the incorrect answer. So making sure that you know those medications, brand name as well as generic name for those drug classes, because if you get a scenario like this or if they're giving you signs and symptoms, you're able to quickly group those together and identify those. So we're looking for which one is not an SSRI. So is it A, sertraline? Well, we know sertraline is an SSRI. That's also known as Zoloft. B, fluoxetine is also known as Prozac. That's also an SSRI. C, Cymbalta. Cymbalta is your answer because that's not an SSRI. And then D, citalopram, aka Celexa, is an SSRI. All right, so question number two, the nurse practitioner and NP student are discussing SNRIs. All of the following are SNRIs except is it A, Effexor, B, Prestique, C, Cymbalta, or D, Celexa? All right, so stem of the question states all of the following are SNRIs except, and this is another thing to pay attention to because people often mix up SSRIs and SNRIs. Although both can be utilized for depression management, SSRIs are focusing on the reuptake of serotonin, whereas SNRIs is a dual effect where it works on the reuptake of serotonin as well as the reuptake of neuroepinephrine. So make sure you know the difference. And it's not that one is better than the other, but a lot of times people would like to use SNRIs because it also gives energy, but those side effects can be more severe with SNRIs. So you often see SSRIs utilized first. But anyway, we are looking for the one that is incorrect. So which one is not an SNRI? Is it A, Effexor? Effexor is an SNRI. B, Prestique is an SNRI. C, Cymbalta is also an SNRI. So your answer is D, Celexa. Because remember, Celexa is also citalopram, and that's an SSRI. So make sure you know the difference between those because they have those similar endings with the I and E. So don't mix those up. So just familiarize yourself with the ones that fall into each because that can easily be a question that you get tripped up on. All right, and so question number three for today. The nurse practitioner started the patient on paroxetine, and the patient is complaining of agitation, insomnia, and diarrhea. Upon examination, the nurse practitioner notes hypertension and muscle rigidity. What diagnosis should the nurse practitioner consider at this time? Is it A, an allergic reaction, B, serotonin syndrome, C, hepatic insufficiency, or D, serotonin rejection? Take a moment to tell me what you got in the comments. All right, so the stem of the question states, what diagnosis should the nurse practitioner consider at this time? I always say if they're asking you about a diagnosis, you need to run it back and see what the assessment findings are so that you can determine what your differential diagnoses are or the actual diagnosis. So looking at what the patient is complaining of, what are those signs and symptoms, what are the assessment findings, those objective findings. So, signs and symptoms being subjective, what the patient is telling you is wrong, and then objective is what are you seeing on your assessment as the provider. So this patient started, they were started on paroxetine, right? aka Paxil, and they came in complaining of agitation, insomnia, and diarrhea. Okay, so you're starting to think, hey, they're having some type of response to this SSRI. And then on exam, the nurse practitioner notes that the patient has hypertension and muscle rigidity. So these are classic signs and symptoms for B serotonin syndrome. Remember, these are like those entry level, like the low level signs and symptoms of early signs of serotonin syndrome. But remember that serotonin syndrome can be life threatening. So the more severe the symptoms, like those seizures and tremors and the irregular heartbeats and high fever and things of that nature, are your more life threatening signs and symptoms of serotonin syndrome. So make sure you're paying attention to those and the progression of it. So you know how to respond, because if you're noting that that patient has like the changes in their heart rate and rhythm, seizures, tremors, they need to be referred out to a higher level of care in a like emergency management, because it can be life threatening. So make sure you know the different tiers of serotonin syndrome as well that they may have, being able to quickly identify it and knowing those entry level, low level signs and symptoms versus life threatening signs and symptoms. All right, you guys. So, as always, be sure to like, comment, subscribe, and make sure you meet me back here. If you need any other resources that I offer, the review book is provided in an ebook option as well as paperback, and they're both linked in the bio of this channel. I also offer a self-paced review course that is designed for family and adult general nurse practitioners preparing for the ANCC as well as AANP. It's broken down by system, including the non-clinical section. All systems have videos, the breakdown with the downloadable workbook as well, and that is also linked in the bio of this channel. That is for independent review, and you can use it on any of your devices. Also, we have a 5-week review course that is a group course. Next one starts on Monday, June the 10th. So be on the lookout of our next up and coming one. And then lastly, I offer one-on-one sessions, and they're broken down in different options. So you can either do it if you have a particular like one weakness, we work on that area during your session, or you can do the option for exam readiness assessment. And then lastly is the custom option of the one-on-one sessions where, say you've been unsuccessful before, then we work to gauge what your weakness is. We structure your studies. I work alongside with you and we take you from unsuccessful to successful. So if you need any of our resources, give us a call at the Nursing Studio at 803-400-6864. You can also shoot a text message to that number or shoot us an email at the nursing studio, the number 1 at gmail.com. As always, happy studying. Bye, y'all.